With over 16,000 cases of monkeypox reported across 75 countries, should Malaysians be concerned of monkeypox? University Science Malaysia virologist Dr. Kumitaa Theva gives us the facts.
At the moment, there aren't a lot of, sort of global coordinated responses yet, but that probably will be set in place with this announcement. So just to give a quick background, at the moment we've had about 16,000 cases globally across 70 different countries, and there was an increase in the cases, about 80% of an increase in cases just from June to July. So that is a really, really huge number. We've also had a couple of deaths recently, which was pretty sad. And we've also seen cases in kids that we didn't see previously as well.
Dr. Kumitaa explained the symptoms of monkeypox and how it is transmitted.
You can have fever, muscle and back aches, swollen lymph nodes, but the most obvious symptom is actually rashes with blisters or lesions, particularly on the face, your palms, your soles, and in your genitalia region as well. But something that's a little concerning with monkeypox is that the incubation period is between 5 to 21 days, so that's quite a long period of time. And we don't know yet for sure if someone is infected and if they don't have symptoms yet, whether they are capable of transmitting it to others. In terms of how it's spread, it can primarily be spread through skin-to-skin contact. So this can be close contact, so respiratory droplets, or if you actually touch someone who has lesions on their skin, that's a very easy way for contact or transmission to happen. But it can also spread through indirect methods, such as if someone with lesions sits down on a couch, or they use towels, so linen surfaces that are infected, it's very, very easy to transmit the virus that way too.
Monkeypox is already present in our neighbouring countries, with Thailand reporting its first case yesterday and Singapore already with 8 confirmed cases. Dr. Kumitaa recommends for the government and the general public to be wary of the disease and ways it can spread.
So we can, of course, start thinking a little bit about, is it worth looking into probably putting some sort of screening methods in countries which have recorded high number of cases. So right now, that's primarily in Europe. That's the epicenter of monkeypox cases right now, where about 80% of the cases have been recorded there. But of course, with certain countries as well, they have started vaccination. So, again, sort of learning from COVID, maybe, sort of putting those information together, we can come up with a way that would keep all Malaysians safe as well, at least when it comes to travel. As far as Malaysians, I think something that we can sort of help ourselves and our loved ones is if we do travel, or if we have been in contact with someone, or even if we just start seeing symptoms, even though we haven't been in close contact with someone who was infected with monkeypox, the best thing to do is to go see a physician straight away. We do have tests available for monkeypox, which is pretty similar to what was done with COVID. So that would be a very quick way to check to make sure that you're completely safe.